So today we'll be discussing a case of upper lid blepharoplasty in which we'll be doing an Asian blepharoplasty. So we get a lot of patients in which patients want upper eyelid creation. This is a very simple surgery, and in this video we'll be demonstrating how we do it, and it is specially done in people from the northeastern origin in our country and who tend to have a single eyelid. They do not have a double eyelid, or they have a very bulky upper eyelid and they want to have a good show of their eyelids so as to put on makeup. And this is a very special kind of surgery in which we remove a little bit of skin, and this is me doing the surgery in which a little bit of skin is marked, which is removed through the knife. And once we have removed a little bit of skin in the area where we want the fold, we then remove it with an electrocautery. Many a times patients do ask me that do we do it through laser, do we do it through electrocautery, radio frequency, or with a knife. So we always combine everything, and once we have marked the skin that is to be removed, we use this cautery to stop any kind of small bleeding that might occur. The whole surgery is done under local anesthesia. That is, you are awake during the surgery. Only the upper lid is given injections which will numb the upper lid, and it is a pain-free surgery. It hardly takes around 15 minutes to 30 minutes. 15 minutes for one eye and 30 minutes for both the eye. And all we need to do is remove a little bit of skin so as to expose the underlying levator muscle. And once that muscle is exposed, we will take a stitch and we'll make a fold. So the fold that we make will remain a bit odd, or will look a bit odd for initial about 1 to 2 months. It takes time for everything to settle down. The upper eyelid has a very thin skin, so the swelling and everything happens a lot, but the good part is the scarring is very less. There is very minimal scarring in the upper lid and it heals really well. This is me removing the skin along with a little bit of muscle, the orbicularis muscle, so as to reduce the bulk in the upper eyelid. We also tend to reduce a little bit of fat from the upper eyelid. So once all this is done, we take this stitch. This stitch is very important. This stitch will make a connection of your lower eyelid with the muscle, so as to whenever you are opening your eyes, the crease will go, the crease will be formed, and this is the key stitch to make the crease. Once this key stitch is put, we put around 3 stitches, one in the center, one on the inside and one on the outside. Once these 3 key stitches are put, whenever you will open your eyes, you will have a crease. So you can see just after the surgery, you can immediately see the crease. This is how you look after the stitch removal on 7th day. The scar is visible initially, but after about 2 months, the lid crease would look very even and you will have a very nice lid crease.